If you've been feeling that constant swelling in your legs, that heaviness in your feet at the end of the day, then I need to tell you a hard truth. This could indeed be a very clear sign that your heart is failing. And maybe you don't even realize that your body has been trying to warn you for quite some time now. Do you know what's even scarier? Most people think this is normal, believing it's just fatigue or temporary water retention. They ignore it, brush it off, and carry on like it's nothing serious. But let me explain how this happens in a simple way so you can truly understand. The heart works like a pump, a strong, powerful pump that sends blood all over the body, carrying oxygen, nutrients, and everything our cells need to survive. However, when this pump starts to weaken, and it often does without warning, it can no longer pump blood with the strength it needs. So what happens to that blood? It starts to build up, mainly in the lower parts of the body, the feet, ankles, and legs. That stagnant blood causes fluid to leak out from the blood vessels into the surrounding tissues, and that's when swelling starts. At first, you might ignore it, but little by little, it becomes more frequent, more obvious, and it often comes along with fatigue. But this isn't the kind of tiredness that comes from working hard. No, this is exhaustion that creeps in even when doing the simplest daily tasks. Have you noticed that you've been getting breathless doing basic things, like climbing stairs, hanging clothes, or even taking a shower? Sadly, this may be directly connected to that weakening heart. And there's more. At night, when you lie down, do you feel short of breath, like there's a weight on your chest? This happens because when you lie flat, the fluid that had pooled in your legs redistributes throughout your body, putting even more pressure on your heart and lungs. It's common for people to end up sleeping sitting up or with several pillows because they simply can't breathe properly while lying down. And if you think this is something that only happens to older people, you're wrong. This can happen to anyone. In fact, sometimes swelling in the legs is the first sign of heart failure, even before any chest pain or more severe symptoms appear. It's the body sending out a clear warning. And listen, do you know that foamy mucus, sometimes whitish or even pinkish, that comes with a persistent cough? That is also a classic sign that the heart isn't managing anymore. Fluid starts to accumulate in the lungs, and this is the result. Now, here's a shocking fact that you need to know. According to data from the Brazilian Society of Cardiology, 1 in every 5 people who develop heart failure only gets diagnosed when they are already hospitalized in a severe condition. That means most people ignore the warning signs until it's too late. And now I sincerely ask you, do you want to be part of this statistic? How many times have you felt your legs heavy, tried to squeeze into your shoes, and thought, oh, it must be the heat, or because I've been standing for too long? But what if it's not? What if that discomfort you carry every day is actually your heart screaming for help? I'm not telling you this to scare you. I'm telling you this to warn you. Because sadly, many people lose their lives ignoring this. People who could still be alive today if they had recognized this simple signal their body was sending them. Do you want a real-life example? Remember the world-famous soccer player Diego Maradona? He suffered for years from heart problems, and it was no coincidence that he was often seen with visibly swollen ankles and legs. That wasn't just water retention. His body was constantly showing that his heart couldn't take it anymore. And I know what you might be thinking right now. But doctor, I take my blood pressure medicine, I do my checkups from time to time. Let me tell you something important. Controlled blood pressure does not mean a healthy heart. There are plenty of people who have never had high blood pressure and still end up developing heart failure. The heart can become weakened for many reasons: living a sedentary lifestyle, being overweight, poorly controlled diabetes, silent heart attacks that you don't even realize you've had, excessive alcohol consumption, chronic stress, sleep apnea, and, of course, the natural aging process when it isn't accompanied by proper care. And the most concerning part is that this weakening of the heart often happens gradually over the course of many years, without showing any obvious symptoms. Until one day you realize your legs are constantly swollen, your feet feel like two inflated balloons, and that fatigue you feel is no longer normal. And here's a fact that's even more shocking. About half of the people diagnosed with heart failure die within 5 years if they don't follow proper treatment. That's a higher mortality rate than many types of cancer. Now answer this honestly, thinking about your own reality. How many hours a day do you spend sitting or standing still without moving? Are you doing any kind of physical activity? Are you taking care of your diet? Are you managing your stress properly? If you notice that you've been neglecting your health, this swelling in your legs is your body giving you a final warning to change. And the good news is that when it's discovered early, it is treatable. It can be controlled. And in the vast majority of cases, the person can return to living a completely normal, active, and healthy life. But for that to happen, you need to act. You need to see a cardiologist, get a complete heart evaluation, and start a treatment plan immediately. Because let me tell you a truth that I share with every patient while looking straight into their eyes. It's far better to spend time taking care of your health today than to waste time later fighting disease. Your body is speaking to you. The only question is, will you listen or will you ignore it once again? There's a type of swelling that triggers all my alarms in the clinic. It's the kind that appears suddenly, usually in just one leg, accompanied by pain, warmth, and redness. And I'll tell you this with complete honesty. This is not normal. It's not something trivial, and it's definitely not something to just wait and hope will get better on its own. This can be a clear sign of deep vein thrombosis, a highly dangerous condition that, if not treated in time, can lead to a severe and life-threatening complication called pulmonary embolism, which claims the lives of thousands of people every single year. And you know what scares me the most? Most people have absolutely no idea they're at risk. I often ask my patients, have you ever spent more than 4 or 5 hours sitting without getting up? Whether it's during a long trip, working, binge-watching series, or even playing video games or scrolling on your phone? And almost everyone answers, oh, doctor, who hasn't? And that who hasn't can come with a very heavy price. Thrombosis happens when a blood clot forms inside a vein, usually in the legs. This clot blocks the normal flow of blood, causing sudden swelling that is hard, warm, and extremely painful. This is not that soft, squishy swelling you notice at the end of a tiring day. No, it's a heavy, firm swelling that hurts even when you lightly touch it. And listen closely. If you're walking and suddenly feel a pain in your calf that feels like someone threw a rock at you, that alone is more than enough reason to rush straight to the emergency room without a second thought. And don't think this only happens to older people. Many young and healthy people develop thrombosis without ever imagining it. Want an example? Serena Williams, one of the greatest athletes in history, almost lost her life to a thrombosis that became a pulmonary embolism. Do you know when it happened? Right after giving birth. Just a few days of resting in bed, like any new mother, was enough for her body to form a blood clot. Now think about it. If a world-class athlete surrounded by the best doctors on the planet almost died from this, what about us, who so often ignore the signs our bodies give us? How many times have you sat for hours, legs crossed, not stretching, not moving, assuming it wouldn't lead to anything bad? And look, there are many factors that increase this risk significantly. Obesity, smoking, using birth control pills, hormone replacement therapy, a family history of thrombosis, recent surgeries, trauma, long periods of immobilization, all of these contribute. Even long trips, did you know? Sitting for more than 4 hours on a plane, bus, or even in a car without moving your legs is already a huge risk factor. Do you know what worries me the most? It's that many times people don't even realize they've developed thrombosis. Sometimes the blood clot breaks loose without causing any major symptoms in the legs, and it travels straight to the lungs. Then, out of nowhere, there's sudden shortness of breath, sharp chest pain, dizziness, a racing heartbeat, and sadly, in many cases, the person simply collapses to the ground and never gets back up. Yes, it happens just like that, with no warning. That's why I always say and repeat, thrombosis is no joke. It's a medical emergency. And some people say, "But doctor, I'm young, I'm healthy." And I tell you as clearly as possible, it doesn't matter. Thrombosis doesn't care about your age, whether you go to the gym, or how well you eat. It strikes whenever you let your guard down. During a long trip, sitting all day at work, going through a stressful period when you stop taking care of yourself, after surgery, and there it is, the risk is waiting. To give you an idea, a study published in The Lancet showed that traveling for more than 4 hours increases the risk of developing thrombosis by approximately 2.8 times. And if the person already has a risk factor, like using birth control pills, the risk rises to nearly 6 times. And it doesn't stop there. You know when your leg starts turning red, feeling warm, swelling, getting hard, and you assume it's just a bruise or something minor? Be careful. This might be your body's way of warning you that there's a clot forming inside, blocking blood circulation. And if you wait too long to act, that clot can travel upwards, lodge in the lungs, and cause a pulmonary embolism. And in case you don't know, pulmonary embolism kills about 1 person every 37 seconds worldwide. Isn't that enough to sound all the alarms? So now I ask you, looking straight into your eyes as if you were sitting right in front of me, are you listening to the signals your body is sending? How many times have you felt your leg hurting, getting warm, swelling, and thought, "Oh, I'll wait and see if it gets better"? But what if it doesn't get better? What if it's actually a ticking time bomb ready to explode? I say this clearly, as a doctor, a specialist, and, most importantly, someone who has seen far too many patients regret not acting in time. If you notice swelling in just one leg, accompanied by pain, warmth, redness, and difficulty walking, do not wait. This is not the time to take an anti-inflammatory and lie down. This is not the time to apply ice and hope it improves. This is the time to run immediately to a hospital, because every single minute matters. And you know, the saddest part is that this is something that, in most cases, can be prevented. How? Simple. During long trips, stand up every 2 hours, walk around a bit, make circular movements with your ankles, stay well hydrated, avoid crossing your legs for extended periods. If you have risk factors, talk to your doctor about wearing compression stockings or even taking preventive anticoagulants. And if you use birth control pills or undergo hormone therapy, have a serious conversation with your doctor about the risks. Because unfortunately, many women take birth control for years without even knowing that it significantly increases the risk of thrombosis. And do you know what frustrates me the most? It's realizing that something as simple as standing up and stretching could have prevented all of this. How many lives could have been saved if more people knew about it? That's why I tell you from the bottom of my heart, if you love your life, if you care about your health, never ignore this signal again. Never again think that swelling in just one leg is something trivial, because sadly, those who think it's nothing sometimes don't get the chance to realize they were wrong. Have you ever felt that heaviness in your legs at the end of the day? That feeling of tiredness, like your legs are tied up, throbbing, tingling, and when you look closely, you notice those little purplish veins, some bulging, twisted veins. Well, let me tell you something that maybe no one has ever explained to you this clearly. This is a clear sign that your veins are failing. Yes, your veins are losing the ability to circulate blood properly. This is called venous insufficiency. And let me tell you, this is not just about aesthetics. It's not just about ugly veins, as many people mistakenly believe. This is your body giving you a very clear and visible sign that your venous system, the one responsible for bringing blood back from your legs to your heart, is not functioning the way it should. Here's how it works. Inside the veins in your legs, there are small valves, like tiny doors, that open and close to prevent blood from flowing backward due to gravity. When you walk or when you move your calves, which are even known as the second heart of the body, these muscles help pump the blood upwards against gravity back to the heart. But when these valves become weak, worn out, or even completely destroyed, do you know what happens? The blood simply starts flowing back down, pooling in your legs, and this leads to swelling, pain, burning sensations, and that unbearable heaviness at the end of the day. It feels like you're carrying a bag of cement tied to your ankles all the time. And many people think this is normal, that it comes with age or because they stand too long or sit too long. And yes, that does contribute, but let me tell you an uncomfortable truth. This is not normal, and it should never be ignored. It is a progressive problem. If you don't take care of it now, it will only get worse. And it truly does get worse. It starts with those tiny spider veins, those little bluish or purplish lines that some people even find cute. Then come the bigger varicose veins, those bulging veins that look like thick ropes that throb, ache, and cause discomfort. And do you know what comes next? Wounds. Yes, wounds that simply do not heal. They remain open, inflamed, get infected easily, and turn the person's life into an absolute nightmare. To help you understand how serious this is, Oprah Winfrey herself, one of the most influential women on the planet, revealed in interviews that she had to completely change her lifestyle because of chronic venous insufficiency. She experienced constant swelling, pain in her legs, and had to start wearing compression stockings every day, along with completely adjusting her exercise routine. And if someone with access to the best doctors in the world had to radically change her life because of this, what does that say about those who still believe this is just a minor cosmetic issue? Now, I want to sincerely ask you, how many hours of your day do you spend sitting or standing still, barely moving? Have you ever noticed that by the end of the day, your legs feel like they're about to explode? Have you felt burning, itching, or that constant discomfort that just doesn't go away? Well, that's not normal. That's your body crying out for help. And the saddest part? Most people only come to the clinic when the condition is already in an advanced stage. They show up when the varicose veins are huge, when they already have dark patches on the skin, which are clear signs that the local circulation has been compromised for a long time. Or even with venous ulcers, those wounds that simply never heal. And by then, what could have been solved with simple care early on has become a serious, complex, painful, and extremely expensive problem to treat. The treatment can cost around 1,030,000 South Korean won, which is approximately 4,000 Brazilian reais. And no, this doesn't only happen to people who work standing up all day, like teachers, hairdressers, or sales clerks. It also happens to those who spend hours sitting: drivers, office workers, receptionists, remote workers, gamers, students. Gravity shows no mercy. If you don't move, if you don't activate your calf muscles, the blood simply doesn't go back up. It stays there, pooling in the legs, causing silent chaos inside your body. And here's something worse. Heat makes it even more severe. Did you know that? On hot days, the veins dilate, become wider, and this makes it even easier for blood to accumulate in your legs. That's why during summer, so many people feel that unbearable swelling, that sensation that their legs weigh a ton. Now, let me ask you a question you've probably never asked yourself. Have you ever seen someone in your family, maybe your mother, your grandmother, or even yourself, with dark spots around the ankles, with those wounds that never close, with those thick, bulging veins? Do you think that's something that comes with age? I guarantee you it's not. It's the price you pay for ignoring your body's signals for years. And the craziest part is that there is a solution. But that solution has to start early. It starts with prevention. It starts with things so simple that they almost seem silly, but they make all the difference. Moving more. Wearing proper compression socks is absolutely essential. And let me be very clear, I'm not talking about those ordinary socks you pick up at the pharmacy. I mean specialized compression socks with graduated pressure prescribed by a specialist and tailored specifically for your needs. If your job requires you to sit or stand for long hours, taking small breaks throughout the day is crucial. Stand up, walk around, do circular movements with your ankles, and perform that simple exercise of rising onto your toes and lowering back down. This activates your calf muscles, what we often call your second heart. And of course, if you've already noticed bulging veins, spider veins, heaviness, pain, or swelling in your legs, it's vital that you see an angiologist or a vascular surgeon. Because depending on the stage of the issue, there are modern treatments available today, such as laser therapy, sclerotherapy, foam treatment, and minimally invasive microsurgeries that can solve the problem without major surgery. But if you wait too long, there's no miracle left. The risk of serious complications like thrombosis or even amputations becomes very real. And listen carefully, this is not an exaggeration. I say this because I've seen it happen with my own eyes. I've treated patients who ignored these problems for years until they reached the point of having to amputate part of their leg because a varicose ulcer became infected, turned into severe cellulitis, and then developed into septicemia. Sadly, this happens more often than you might think. That's why I speak to you with the full responsibility I carry as a doctor. Never treat your body like it's disposable, because it's not. Right now, your legs are crying out for help. Whether you choose to listen or not is entirely up to you. There's something that genuinely frustrates me deeply. It's when people start noticing that their legs are swollen, heavy, and their shoes feel tight by the end of the day, but they dismiss it as just aging, water retention, or heat. Then they spend weeks, months, even years trying to fix it with herbal teas, elevating their legs, or getting drainage massages. But here's something almost nobody realizes. Many times, the real cause of that swelling is right inside your own home. It's sitting there in your personal medicine cabinet. Do you know what it is? It's the very medication you take every day thinking it's helping you. And this is where most people are shocked, because the majority have no idea that some medications, very common ones, taken by millions of people worldwide, can have exactly this side effect: swelling in the legs, feet, and ankles. Let me ask you honestly, did you know that blood pressure medications like amlodipine, nifedipine, diltiazem, and Verapam, which belong to the class of calcium channel blockers, are some of the biggest culprits behind this kind of swelling? That's right. These medications work by dilating blood vessels to control blood pressure. But this same dilation can cause some fluid to leak out of the vessels into the surrounding tissues, collecting exactly where gravity hits hardest, the legs and feet. And the cruelest part of this is that very often, the person starts developing this swelling right after beginning the treatment. But no one makes the connection. They think it's just a coincidence or caused by something else. And that's when the crazy cycle begins. You take medication for blood pressure, you swell, then you think it's water retention, so you start drinking herbal teas, reducing water intake, looking for countless solutions, all while not realizing that the real problem is the very pill you're taking to control something else. And it doesn't stop there. You know that medication used for diabetes that many people take, pioglitazone? Yes, that one is also a major culprit for swelling. And it doesn't end with that. Anti-inflammatories, corticosteroids, hormones, birth control pills, and antidepressants, and even some medications used for psychiatric conditions, all of them can have fluid retention and swelling in the legs as a side effect. This leads to that daily discomfort that just keeps getting worse. But listen carefully, I'm absolutely not telling you to go throw your medications in the trash. That would be extremely dangerous. Because if you're taking medication for blood pressure, diabetes, or any other condition, it's because your body truly needs it. The problem isn't the medication itself. The real issue is not knowing that this can happen, and more importantly, not talking to your doctor as soon as you start noticing these signs. I've lost count of how many patients have come into my office completely desperate, thinking they had heart problems, believing they were suffering from venous insufficiency, or convinced they had kidney issues. And when we thoroughly investigated, the real culprit was simply a medication. What's worse is that sometimes these patients spent months undergoing tests, spending nearly 500,000 South Korean won, visiting multiple specialists, and no one even bothered to check the leaflet of the medicine they had been taking for so long. And do you know what frustrates me even more? It's the fact that this happens even among healthcare professionals. I've seen countless fellow doctors treating patients for swelling without even considering whether the patient was taking a calcium channel blocker, an anti-inflammatory, or any other medication well known for causing this kind of side effect. So now, let me ask you a very direct question. When was the last time you read the leaflet of your medications? Have you ever stopped to check if one of the side effects listed includes fluid retention, peripheral edema, or swelling in the legs? Maybe you've never done that. And perhaps that's exactly why you've been struggling for months with a problem that could be solved in a much simpler way. Let me tell you something else. It's not uncommon for me to see patients arriving completely exhausted after trying everything: lymphatic drainage, herbal teas, massages, compression stockings, elevating their legs, cutting out salt, exercising, and still the swelling doesn't go away. And do you know what often happens? Sometimes simply adjusting the medication does the trick. Switching a medicine, lowering the dose, or in some cases, adding a diuretic when it's safe, makes the problem just disappear. But pay attention, this should always be done with medical supervision. Never, under any circumstances, stop taking a medication on your own. That medication might be controlling something much more serious, like high blood pressure, which is one of the main causes of stroke and heart attack. What you should do is talk to your doctor and say, "Doctor, ever since I started this medication, I've noticed that my legs are swelling and my feet feel heavy." Together, you can decide whether it makes sense to switch to another medicine that doesn't cause this side effect, or at the very least, figure out how to minimize the impact. Now, let me ask you again, very directly. How many times have you thought the problem was in your body when in reality it came from something you were putting into your body every single day, believing it was helping you? For me, understanding this is completely liberating, because once you realize it, you break free from that cycle of suffering, guilt, and frustration, thinking that your body is failing, getting old, or breaking down, when in reality, it's not your body that's failing. It's a reaction, often predictable, that can and should be adjusted. So pay very close attention to the signs your body gives you, because sometimes the solution is much closer than you think. It might be in an honest conversation with your doctor, in a simple review of your prescription, in one small change that can make an enormous difference in your quality of life. And I guarantee you, there's nothing more transformative than that. Because living in good health doesn't mean living without disease. It means living by understanding, listening to, and respecting the signals your body sends you every single day. If there's one thing you need to take away from this video, it's this: leg swelling should never be ignored. Never. Whether it's your heart calling for help, your veins struggling, a hidden risk of thrombosis, or even the side effect of a medication you take every day without even realizing, your body always sends signals. And those who choose to listen to these signals choose to live longer and live better. And if you've made it this far, congratulations! That already shows you are truly committed to your health. And if you want to take one more step forward on this journey, on this mission to care for what's most valuable to you, just click on the next video showing up on your screen right now. There, we'll dive even deeper into this topic, and I'll show you how to keep building a healthier, lighter, and much more balanced life. Thank you so much for being with me up to this point. I'll see you in the next video. Let's go together on this mission.